Therapy Chat Podcast, episode 274.
This is the Therapy Chat Podcast with Laura Reagan, LCSW-C. The information shared in this podcast is not a substitute for seeking help from a licensed mental health professional. And now, here's your host, Laura Reagan, LCSW-C.
Hi, welcome back to Therapy Chat. I'm your host, Laura Reagan, and today I'm very honored to be bringing you a conversation with Dr. Huong Diep and Kim Hooper, who together with Meredith Resnick have co-authored a book about the subject of pregnancy loss called All the Love. In our conversation today, you'll be hearing Huong speak about the trauma that is often overlooked as an experience when people have pregnancy loss. Oftentimes it happens, but because it's so taboo in our culture, people seldom speak about it and people don't know what to say to the person who's going through it. And it can be a very isolating and traumatic experience, both the physical aspects and the emotional aspects. So you will hear Huong speaking about that and about how diverse types of couples may have particular concerns regarding pregnancy loss. And Kim is going to share about her experiences of pregnancy loss and how it impacted her and what people who have gone through that need in terms of support. So I hope you'll enjoy this conversation, and let's just dive right into my interview with Dr. Huong Diep and Kim Hooper. With me today are Dr. Huong Diep and Kim Hooper, who together with Meredith Resnick are the authors of All the Love, Healing Your Heart and Finding Meaning After Pregnancy Loss. Huong and Kim, thank you so much for being my guests on Therapy Chat today.
Thank you for having us. Yeah, we're excited.
Yeah, I'm really excited too. I know that this episode is going to be so informative and helpful for many, many people who are listening. And I'm really excited to discuss the topic of pregnancy loss with a focus on trauma response and also the considerations for LGBTQ plus couples and racial, cultural, and socioeconomic issues for BIPOC folks that could impact their way that one recovers from this type of experience. So before we even really dive into our conversation, can I ask you each to briefly introduce yourselves to our audience and tell them a little bit about who you are and what you do?
Yeah, so I'm Kim Hooper. I am a writer by trade. I never thought I would really write a nonfiction book like this until I experienced pregnancy loss myself. So I had 4 losses starting in 2015. I had 2 ectopic pregnancies. I had an early miscarriage, and I had a second trimester loss of my son. And I eventually did have a daughter who's now 3. So there is that quote unquote happy ending. But speaking like you said, there's still residual trauma, and there's definitely trauma issues that come up with pregnancy loss. And I think when I sat down to write the book, that's some of what I really wanted to focus on, is kind of all the things that come up with a pregnancy loss, where you're grieving not just the baby or the babies that you've lost, but grieving kind of a belief system about the world and kind of what that trauma is like. Huong and I have been friends. We met 20 years ago. So when I sat down to do this book, I definitely wanted to include experiences beyond just my own. And I knew Huong has seen hundreds of clients over the years, and she's worked with LGBTQ plus couples, BIPOC couples, and she's learned a lot about like the intersectionality of how different things can make pregnancy loss grief even more complicated. So I kind of wanted her perspective in the book in addition to my personal story. So that's kind of how we came to meet and write the book together. And it's been a really great experience to kind of be part of this community.
Awesome.
Yeah, my name is Dr. Huong Diep, and I am a board certified psychologist. And I am based in San Diego, but I've been working sort of all over. And my focus is really looking at the intersection of gender, culture, and language through a very trauma-informed and culturally sensitive lens. And specifically in terms of looking at the intersection of LGBTQ and, BIPOC folks. And so when, as Kim's friend for all these years, I definitely saw her, going through, experiences firsthand. And despite, even being a mental health therapist, there were times that I felt just a little helpless in terms of really wanting to be there for my friend, but sometimes afraid, of saying, the wrong thing. So I think that was something that I could empathize with folks who maybe sometimes don't say anything at all for fear of saying something wrong. But then, so I think we're really excited to be able to give some education of like, hey, here's what might be helpful, and here's how to approach, this experience. And in addition to really, just amplify certain voices that maybe have been marginalized or oppressed, or just that, haven't had the opportunity to share in their in that what typically is then known as like a more disenfranchised grief.
Yeah. So when I hear you say disenfranchised grief, and we talked about this a little bit before we started recording, that it seems to me, and pregnancy loss is not my specialty, but it's certainly something that many people I know in my personal and professional life have experienced. And I've felt unsure of what to say when it's happened with people in my personal life. I've learned more about how to respond professionally. But, there are so many messages in our culture about family, mixed messages, if you will, about what family is, what, the experience of pregnancy, and then when there's a loss, oftentimes we don't culturally really talk about it. It's, we often hear later someone saying, oh, well, I never mentioned this to you, but I have had 3 miscarriages prior to conceiving this baby. Or, it's almost like it didn't happen sometimes, that when there's a miscarriage, it's like, oh, they were pregnant and now they're not, and just don't talk about it kind of thing. So Kim, are you open to sharing a little bit about sort of what has impacted you as you've gone through these experiences?
Yeah, well, I think you're right that this is something that as a culture, we're so silent about. And I think it really comes down to women feeling just a lot of shame about this loss, like kind of feeling like, well, my body was made to do this and it somehow failed. It's failed me. It's failed everybody else. So I think there's a lot of silence and shame that's still there, even though more and more people are starting to open up about their experiences. I think that's still there. Like you said, as a culture, we're just not great with grief in general, but this kind of, grief for a baby that you never saw yourself, like you didn't see your friend's pregnancy, you didn't even know about it. Then it's really, it's kind of compounded the difficulties that people have with grief. So especially with this kind of loss, I think there's a lot of what Huong has informed me is called toxic positivity. I think it's easy for people to kind of just try to rush you past your grief and just say, it'll happen when the time is right, or one of them will stick, or maybe, it wasn't meant to be this time. And kind of everything is said with this lightness that is really invalidating of the experience. And for me, that made me feel more alone. I already felt kind of ashamed and quiet. But then when I would hear anything like that, and I was very sensitive to it, so it could be as small as somebody saying, well, let me know when you're ready for a happy hour. And I just would recoil and retreat. And because I just didn't get the sense that anybody really wanted to know the depth of the pain I was going through. And I think that adds to the silence. And then you're kind of then in a real isolated situation where your grief isn't really being validated. And for me, I didn't trust my feelings. Like, am I too sad? Like, am I not handling this well? Like, am I not doing this right? Whatever right is. So I think that can be really challenging when you're going through it. It can kind of get you into really up in your own head.
Yeah, that's when you were talking about that, it's like I'm just hearing sort of like everyone needing to skip over how you feel and just get to when are you going to get over this so that I can be comfortable or something, you know?
Yes. Right. And I mean, I get it because they didn't experience what your body has been through. They didn't hold the dream of the baby. There's nothing visual for them to really attach to. So I can see why, people want to kind of like rush past it. And even therapists, I saw therapists during that time. And I think it's even hard for therapists sometimes to sit with that difficulty. I mentioned to you before we went on that I had a therapist who said after my third loss, like, well, you're not going to try again, right? I mean, like this is too much or, and I think that's just her discomfort with like, I can't see you continue to go through this. Like, you're not going to keep doing this, right? And I did feel when I tried again that people thought I was foolish and I couldn't really open up about the hope or the determination I had, which again creates a lot of isolation. So,
yeah. And also, as I was hearing you speak, it's that isolation, like you said, that's a common feeling for people who've experienced trauma. And so one of the things that I had mentioned before we started talking was how, it seems like people think they should be over it. And especially if, like you said, you have a daughter now, but you lost a son and 2 ectopic pregnancies that you had before that. Or did I get that right?
2 ectopic pregnancies and a miscarriage. So I had 4 losses total.
4. Sorry about that. So you lost a son, you had another miscarriage and 2 ectopic pregnancies.
Yeah.
Yeah. And, then it's like goal-oriented U.S. culture. Like, well, you got that baby, you got your daughter now. So, okay, everything's all right. Right. And it's like, it ignores the experience and the process and the pain.
Yeah. And I do try to speak a lot, and Huong and I do write about this in the book too, about how it doesn't just go away. Because I do think we have this rainbow baby culture where we assume that once somebody has that child, that it erases the pain. And there's still things, and I've been through a lot of therapy, but there's still things that I continue to work through. And I have evidence of the trauma that comes up at times. Like I have a lot of medical anxiety. Like I last year went to get my knee ultrasound, and they were just like bringing in the ultrasound machine with the gel. And I was just like, got this like visceral response. So there's things that last. I mean, there's, fears and anxieties that linger that I think people don't give a lot of attention to. So while I'm happy that more people are coming forward and sharing their experience and saying, oh, I had a pregnancy loss, I still think it's important to talk about the whole process and the whole trauma response and how we recover from that. Because, I think there's still a lot of silence about what that all entails.
Thank you.
Yeah. And I think too, of just listening to the both of you chat about trauma, and that in my work with trauma, what I see oftentimes is that the first trauma, right? The pregnancy loss, the assault, the death, whatever the traumatic incident is oftentimes not what my client comes in about. It's the secondary trauma, which is then the reaction, right, of others to their trauma that further perpetuates the stigma and the pain of what they're going through, right? Like, let's say with an individual, and unfortunately in our culture, that's very, blaming and shaming. Let's say someone experienced a sexual assault, right? And then asking, well, what did you do? What were you wearing? Or why were you out at night, right? Or in this case with a pregnancy loss, right? Being like, oh, but you were exercising a lot. Or, or again, also, oh, but at least, you could get pregnant, like you could do it again. Or you already have one child, right? So it's the reaction oftentimes, what I see in my work, that then further even cements the loneliness and the isolation that Kim mentioned, that just further exacerbates the symptoms, of potentially, diagnosable PTSD or just a traumatic, response. And that with the lack of knowledge of just the different physiological reactions that our body has to a trauma response and a traumatic event, that oftentimes, especially if, an individual, let's say in this case, post-pregnancy loss, is already going through such a surge of hormonal changes and everything like that can either just credit it to, oh, this is just my hormones, or other people will be like, oh gosh, it's just hormonal, or just really feeling like they're going crazy. I mean, I have often a lot of clients come in to be like, I just feel like I'm going crazy. But their body is having, a traumatic response to, I mean, if we look at the medical invasiveness of, and I know Kim talks about that in the book, of the different procedures, which I did not know about, that it entails. It is literally invasive into your body. And so I think that one of the things I try to do in my work is really just to validate and to hold space, for people, to believe them when they say, like, this is still really hard for me, or this is hard for me, and this is painful for me, and nobody else, gets it. And, especially when potentially it's their partner.
And I do have to say too, it's like, I never understood, I thought trauma was like these major, huge events. Like, I remember my first ectopic pregnancy, and I called my therapist, who I hadn't seen in a long time. And I just left her this voice message. And I said, I know I haven't seen you in a while, but this thing happened to me, and it's not, I'm fine. It's nothing like awful. It's just, I lost this pregnancy and feel like, and when I came in, she was like, Kim, this is a trauma. And I was like, no, it's not a trauma. Like, I think it took me a really long time to even embrace the fact that, oh, this is a traumatic event. Like, a traumatic event does not have to be like, I don't know. I didn't know that what a traumatic event was until I kind of kept going to therapy and uncovering all that. So, and maybe that's because I felt some of the pressure to not consider it a trauma, to just like move on. And I think that it is validating, and therapists, it helps when therapists just validate it. Like, no, this is a trauma, because, I know it felt like that inside, but to have somebody else kind of confirm that was just helpful.
Yeah, that's so great to hear, Kim. I'm so glad that therapist was able to do that for you. And that I think, a lot of times in my work too, it really is putting a name to a cluster of experiences or symptoms or reactions, right? Because and that so often, as you're going through it, it's hard to parse apart the different feelings. And I think, and again, I don't like to diagnose or overly label or pathologize, but oftentimes just naming an experience, for what it is in terms of, and then to show, hey, here's potential trajectories of other folks, who have gone through, similar experiences. I think there is from what you've shared, a sense of comfort and validation that could be like, okay, like, I'm not going crazy, and I'm not the only one that is experiencing this.
Mm-hmm. Yeah. And as a culture, if we come to seeing pregnancy loss as a trauma, because even just that statement would be revolutionary. Pregnancy loss is a trauma. Like, women cannot just go back to work right after and be productive as they always were. And we're not going to be ready for happy hours, probably. I mean, some people might, or that might be their, what they do. But like, I think recognizing it as it's a traumatic experience in our culture would really shift things.
Yeah, but I think we've seen too, in social media, right, that, let's say, for example, with Chrissy Teigen and openly sharing about her, pregnancy loss, that we see that there were some people who applauded her and, was like, that's so brave. And unfortunately, there was still that camp too that was like, TMI, like too much information, right? That like they, again, just like didn't want to see it. Right. But I think it goes back to that conversation you had about, I think that for a lot of folks, they were trying to like silver line, right, your experience, and that the whole at least, right, what Brene Brown says is kind of the difference between sympathy and empathy, right? Because for somebody to truly, even if they hadn't experienced a pregnancy loss, they would have to tap into something in them, like some grief, some loss, some hope that didn't materialize. But not a lot of people, want to do that or have the self-awareness or the empathy, let's say, to really sit in that pain for a minute, to be like, okay, I haven't experienced a pregnancy loss myself, right? But how would I feel, or how can I imagine how Kim would feel, in this moment? And does this remind me of something, for myself? And so I think that's the part that I think oftentimes, clients will say too, like, oh, I'm getting a lot of sympathy from people, like kind of the pity face and, like bringing over the casseroles and, all that stuff, which, is great as well. But definitely, I think oftentimes just sitting and having somebody sit next to you and sit in with your pain, I think is one of the most powerful and healing things that, we can do, especially as therapists.
Yes.
And that's so powerful, because I think that's part of it, in the big picture with our culture doesn't like to talk about painful things. We have this whole history that we don't like to think about or talk about in terms of, oppression of peoples and genocide. And, it's but look how we're so great. We technology and we make so much money and buying stuff and we look so pretty and, focus on it's almost like culturally toxic positivity is our brand.
I told Hong recently that I feel like our culture has avoidant personality disorder, because we're not willing. We don't want to deal with it. We're just like the gloss over things. And so when you're going through something hard, it can be you just feel this very jarring. You feel kind of like you're on a separate island from the rest of the world. Like everybody else is kind of pretending like everything is great. And you're kind of like, no, I'm in a lot of pain. So it can be very unsettling, I guess is the word.
Yeah, it makes me think about what you said at the beginning of this conversation. I didn't jot down the words you said, but you said something about change in the way you see the world after this experience. Can you talk a little bit about that?
Yeah. I mean, for me, I think I'd always been one of those people who thought life was generally fair. So if you do the right things, good things happen to you. I hadn't really had anything horrible happen to me. I hadn't been through any terrible grief. And so this kind of just rocked me in that life is very fragile and sometimes bad things just happen. They don't mean anything. There's no rhyme or reason. If you're a good person, it doesn't mean that you're immune from certain things happening. So that kind of just rocked me. I mean, it seems like such a simple truth, but it's something I had never really felt in my core. We don't have the control that we want to think we have. And at first that was very depressing. Now I see it as very liberating. We don't have control, thank God. But I think in the beginning it was just what? I can follow all the rules. I can take all the vitamins. I can do all the things. I, have been a high achiever my whole life, but I cannot sustain a pregnancy. Was just so reflective of many bigger things for me, of things that I just couldn't control. And I think the word I said was paradigm shift. It just shifted how I saw life and how I saw fairness and how I saw fragility and I think the grief that I went through was grieving the babies. Yes. But just grieving that kind of innocence, naive belief system, which would have been nice. I mean, it would have been nice to go through life, always having that. But I do think that all of us come to that kind of disillusionment at some point. And obviously I've made meaning in my own way, but to just accept that in and of themselves, my losses didn't mean anything. They didn't mean I wasn't supposed to be a mother or that my body was defective, or they didn't mean those things. So I had to kind of create my own meaning. And I know they added that as a stage of grief a year or two ago. And I found a lot of peace and comfort in time, but it was very jarring. It was really changed the way I saw everything. It was probably my first trauma that had really shook me in that way. So, and I'm sure you guys as therapists, that's common.
Yeah, Kim, I think just even listening to you talk now, it just made me think a lot about the work that, I do. I'm sure Laura does as well in terms of, I'm trained in cognitive processing therapy. So CPT, which is used a lot for in the Veterans Administration and the VA, with vets afterwards. But it's really examining our stuck points, right? What are the things that we have kept repeating to ourselves following a traumatic event? And so, potentially if one of the stuck points for some folks experiencing pregnancy loss was, it was my fault, or, my body's defective, or, or whatever it is. And so it's really examining the stuck points and how to challenge that, and a little bit of narrative therapy, as well, and schema therapy of really trying to, how can you integrate sort of this traumatic experience into your life beliefs, right? And that, for a lot of folks, it sounds like you have been able to do that work to not become jaded and cynical about the world, but to know that, yes, it's unfortunate that, it's not the simple rule of good things happen to good people and bad things happen to bad people, right? But I think it sounds like you've been able to kind of process it and, get to a place where you can create your own meaning, from the experience.
Yeah.
Well, something interesting that you're talking about, some of these things I can't help but notice. Some of the things that you're talking about, like my body's broken, or I'm not meant to be a mother, identity things. Those are, if you are a therapist, those are like indicators that the person is talking about the wounds of trauma, because it shifts your worldview. One of the things that is an indication of, for example, PTSD, not to say that just having that change means one has PTSD, but one of the aspects of a PTSD diagnosis is that, a change in the way you see the world. So it's something that trauma does. So, I was saying to you before how I think that many people who experience pregnancy loss do a lot of, when they seek support, they're doing grief work and they're seeking, grief therapy or infant loss or pregnancy loss groups, but sometimes the trauma part isn't part of it. And that, so then there's still a piece of it that's unresolved, even if the grief part has healed, so.
Yeah, that makes sense. Yeah.
So Huong, can you share a little bit about some of the ways that this type of experience can land for people who are not, like for LGBTQ couples, and for people of a variety of cultures and ethnic backgrounds?
Yeah, so I look at
big question.
But I look at my viewpoint as I view the world through an intersectional lens. And so in terms of intersectionality, which is a phrase that's kind of it's a buzzword now, but it was actually coined back in 1989 by Kimberly Crenshaw, which is just looking at how the different race, class, gender, and other identities intersect with one another and potentially create overlapping systems of discrimination and oppression, right? So basically, it's just understanding that all oppression is linked and that everyone has their own unique experiences of discrimination and oppression. And so you can imagine, so let's say piggybacking on what we just talked about the idea of, oh, my body is broken. So if that's a thought that a cisgender heterosexual person has after pregnancy loss, you can imagine only for a person who grew up, identifying as queer, within part of the LGBTQ community, that ingrained sense of internalized homophobia, internalized transphobia, of already feeling like something's wrong with their body, right? Like, let's say having gender, dysphoria, that their current gender identity does not match their assigned gender or assigned sex at birth. That's just going to perpetuate that even more in terms of the idea that, oh, wow, like maybe my family was right. Maybe there is something wrong with me. And that's why I'm not able to have a child. Or, oh, wow, my grandma was right. Like I am, condemned and sinful. And that's why, I can't have a child.
Or couples who are told that it's not natural. So then if they have a loss, it's like it brings up the trauma of having heard that for years leading up to this moment. So
definitely. And that for a lot of couples that I work with and, done research, looking at the research, that there is a, whether conscious or subconscious, desire to be a quote unquote normal family, right? And that this idea of like, okay, well, if I'm outside walking with my kid and my partner, then maybe we're not going to get harassed because people, aren't going to harass families as much. And we're finally going to fit in with everyone else because we can all talk about being sleep deprived, together or whatnot, right? But then there's a sense of, oh, So now I'm not part of that club either, right? And on top of that, that disenfranchised grief of, and then nobody understands, right? If you look at, especially, let's say two male identified folks, a gay couple who are using a surrogate, let's say, and that surrogate experiences a pregnancy loss. I mean, I think for a lot of folks, they're not going to understand and just be like, but you physically, right, didn't get pregnant, or like you never met this child, or you didn't even know your surrogate, perhaps, right? Or for a trans male. So let's say somebody who is assigned female at birth and they still have the female parts so that they can get, medically pregnant, that then, the steps leading up to that, I think oftentimes folks don't realize that, they have to, let's say they have been on hormone replacement therapy, they have to go off their estrogen to allow, and perhaps take even additional testosterone to kind of get testosterone, I'm sorry, I'm reversing my hormones, that they're have to
go off their
testosterone. Thank you. To, allow the estrogen to perhaps take more estrogen again, that one that is like, all those hormonal things. It's like now they're going through like a third puberty, and then potentially to experience that increased dysphoria, right? Of basically allowing their bodies to, go back to a place that they don't identify with, but the desire, right? Let's say in that scenario, to have a biological child. And so I think these are different, I know there's already such a dearth of providers who can provide sort of gender affirming services. And then we add on this another layer of like gender affirming services within the pregnancy and perinatal, postnatal kind of community.
Thank you for saying that. And can you add anything about like just views of family or roles that how culture may influence those as well, if there's anything that you think would be relevant?
Yeah. I mean, I think when, even despite all our social progress, when, you ask somebody, think of a family, right? In your mind, I think a lot of our minds immediately this idea of like a man and a woman and 2.5 kids, right?
And a white picket fence.
Yes, there you go. And a dog now, a pandemic puppy now. And so I think that, we still live in a very cisgender heteronormative world. And I recognize, as I'm saying all this, I just always want to recognize my own privilege and that, I am a person of color. I am a child of refugees. But, my privilege is that I navigate this world as a cisgender heterosexual, individual. And so I think I don't have the lived experiences. And so, but I have, more than 15 years of the clinical experience and research and, being an ally, to the community and holding space, for stories. And so I think that, for me, of checking my own privilege and my own assumptions of what family is, what gender identity is, of my own sort of my own biases. And I think that's usually when I do trainings for other therapists, it really is asking them to really think about potentially their own assumptions and their own biases and what they may be consciously or subconsciously, bringing into the therapeutic, room, and that none of us are immune to, societal pressures and we look at like a marketing and it's all just so deeply woven into the structure of our everyday lives, and not to, discount or, saying that that's permissible. But I think it is something where oftentimes, in terms of when working with the marginalized communities, of really examining sort of the different layers of structure, right, that can potentially oppress, these different groups.
I love what you were just saying, Huong. And I'm also thinking about how, there's so many layers and so many structures involved in a person's experience of marginalization, oppression, or feeling a sense of belonging, identity of what it means to be a parent, what it means to be a woman, what it means to be cisgender, to not be cisgender, and all the forms that can take. And also I'm thinking about, like, for example, you talked about Chrissy Teigen before she talked about her pregnancy loss, or I think her baby died at birth. I can't remember exactly if
he was stillborn.
He was stillborn.
Yeah.
Okay.
Yeah.
Thank you. But before that, I believe I remembered her talking in the past couple of years about her experiences of, postpartum anxiety and depression, perinatal mental health. So she's done a lot to raise awareness of that. I'm thinking about other celebrities like Dwayne Wade and Gabrielle Union, I believe, where they had a baby through a surrogate and they were posting about it on social media, and people were shaming them, saying that's not really your child and things like that. And Serena Williams talking about her experience of having a pulmonary embolism during delivery and not being, or just following delivery and not really being taken seriously. So there are a lot of, aspects of ways that it's kind of like what you were saying about the secondary trauma, the ways that people respond compound the person who's going through it and their partner, their experience of the loss. So, like even saying like it was God's will and things like that, that people mean to be helpful, but it feels unsupportive, invalidating, and makes the person feel more isolated and alone.
Yeah.
Yeah, definitely. And I think, just you bringing up about Serena Williams. So I'm like, if this is Serena Williams, she's getting poor treatment, right? You can only imagine.
If Serena Williams can't be taken care of well enough, then.
Yeah. And we know that there's this concept called the weathering effect. I don't know if you've heard about it, but basically, for Black women, because of their different layers of oppression, that this weathering effect is that the different layers of stress, because we know that stress is not good for us. And the compounding impacts of it just leads to potentially poor outcomes during pregnancy and an increase in pregnancy loss. And on top of that, potentially maltreatment or poor treatment or, not getting into correct diagnoses amongst, medical providers, due to lack of training or subconscious or conscious biases.
Yeah. And maternal death too. I mean, we know Black women die more in labor or immediately after labor. The stats, show us clearly that there are biases. So, and Hong shared a good example in the book that kind of opened my eyes to something when she was talking about a Black client who had a pregnancy loss. And I think it was like a misdiagnosis or something. And she wanted to get very angry with the doctor, but she felt like I have to compose myself and not express my true feelings because I don't want to be labeled the angry Black woman or, so just thinking about that and having to like censor yourself in that way, it is added layers of stress that I think a lot of us don't realize or see. And the intersection of that with the grief of pregnancy loss, it's just it's an added thing. So.
Yeah, it just makes me think how confusing it must feel for someone to go through this and have these this grief and this trauma, and then all these other complicating factors that can just make it so difficult and so overwhelming. It's like, where do you even start? And to ask for help. And if you try to speak with people and they're trying to be supportive, but it's making you feel dismissed and invalidated and alone. And, like, how can you even trust that if you ask for help that you'll be able to receive the help that's going to resonate, as you mentioned, even with, clearly well-intentioned therapist you were working with, Kim, who said something that you found very painful.
Yes. Yeah. Like telling me, you're not going to try again, are you? As if I was like insane to consider keep trying when I already felt that way a little bit inside. So it didn't help to hear it kind of validated in that way. But I think even for therapists, it's tempting to kind of, cover the pain or limit it or something, to watch somebody going through something so painful like that. So, yeah, I mean, the best therapy for me has been the therapy that allows me to just have my feelings and validate them. And, the validation goes so far to healing. So.
Yeah. And I think too, I think I wanted to share too, just that even if somebody is looking for therapy, we know that unfortunately, there are so many barriers to therapy, whether that be, first the stigma, right? Unfortunately, I mean, I think it's gotten better during this pandemic that not that I want to silver line this pandemic either, but that definitely I think people are realizing that mental health, right, is important. And so I think, for folks of dealing with their own stigma and oppression and ideas of what mental health is and isn't. And then on top of that, the potential barriers of just, how do you even can you afford therapy, right? Does your insurance cover, therapy? I know with telehealth right now, that has increased, some access and stuff, but there's still licensure restrictions. And then on top of that, really finding, the right fit, especially if you're looking for somebody who, has, who's gender affirming and, an ally to, the LGBTQ community. And on top of that also has, kind of perinatal experience, right? So it's almost like kind of sometimes I know I have some clients, being like, oh my gosh, it's like trying to find a unicorn.
Yeah. So I'm wondering, it sounds like your book, for one, is an amazing resource just to even help people understand that they're not alone in this experience and that, sort of making sense out of it. Mm-hmm. Through, hearing about Kim's experience. But do you two have any resources that you would recommend to people or suggestions on how to find someone who can help when one has pregnancy loss, and especially for the more marginalized groups to also be able to access that?
Huong probably knows more than I do, but I know that for me, there are a lot of therapists these days who do specialize in pregnancy loss and perinatal mental health. And I'm seeing that specialty more and more. So I think if you want to find somebody who can relate on that personal level and knows a lot about this experience, you can definitely seek out those particular specialists. We always tell people to look at the directory on Psychology Today. And then there's community counseling centers that often have sliding scale fees, just using the best practices that I've found as a therapy client over the years of just having a phone consult, a 10-minute chat with a therapist just to kind of see if the therapist really gets you and understands where you're coming from and what you're struggling with. And to me, you can tell a lot within 10 minutes of just, if I share something about this pregnancy loss, are they jumping in with the right or the wrong things to say? Mm-hmm. Do they kind of know how to validate what I'm going through? You can learn a lot in a 10-minute call. So I kind of feel like that's the advice I give people. And everyone's financial situation, it's if you have insurance, you of course start with your insurance mm-hmm. website. If you're looking for sliding scale fees, there's community counseling centers and options. So it really varies. And Huong probably has more information on that just because she's so plugged into resources.
Yeah. And in addition to that, too, I think especially if you're looking for somebody who identifies with a certain racial ethnic group, there definitely are different websites that I can share later that you can maybe link to your show notes or something like that, sure. That, for different communities, right? Because I know oftentimes too, it's that extra layer of I don't want to have to explain certain things about my culture or my beliefs on top of then also explaining about my pregnancy loss, right? So I think that's why for, some folks that's been very helpful or, and definitely too of looking at your local LGBTQ chapter and reaching out to them. And I always tell people, it is unfortunately a kind of having to be a very proactive kind of search. And that if if there is somebody you're like, oh my gosh, this would be the perfect person for me. And then, they're full, just always ask them, hey, do you have anybody else you would refer? Right. Because I'm always, if somebody reaches out to me and I'm full, then I'm always like, okay, well, what area are you looking for? What are you doing? Because that's just a very, as a professional, so that's what, we do is then being like, okay, I don't have room for you right now, or, my schedule's full, but, here are other providers that I trust and that I can refer you to, or at least here are different resources, and again, a plug for the book that there definitely is a list of resources, at the end, and there's different screeners in there as well. And again, no replacement for individual one-on-one therapy, but the way we wrote it is that if somebody has a specific concern, they can go to the table of contents and go specifically there, and then they'll read about, Kim's kind of personal experience, with that, and then either Meredith or I sort of therapist, hats view on that, and all in very non-jargony, language. And so I think that's what, I think we're really proud of our book for that, because it's just is really accessible to a lot of folks who unfortunately may not have the time, money, resources, whatnot for right now, get into individual, therapy. And that for some people, I think too, as a therapist, I forget, like, they're really, it's scary, right? To go and, sit across from, or I guess across the Zoom screen now from a stranger and just start to open up. And so I think I'm very aware of that, given that I've been in therapy myself too. And so I think I always have to remind myself, like this, it's going to take some time to, to build a rapport. And that especially if, someone hasn't been studying psychology for the last 15 years as I have or something, then it's definitely going to be, entering a new environment. So I think in a way, maybe this is a little gateway into understanding more that therapists are human too, and that, we're not scary, and that, but that we have, the training and a lot of us, potentially the lived experiences to support and to provide that space and validation.
Awesome. And I just want to add quickly that in my area, our local hospice organization offers a lot of free counseling and support groups for around grief and loss and related to many specific topics. So I think that's a common thing that hospice organizations often do, and a way for people to maybe ease in if they're not either able financially to start with a therapist, or they also aren't sure, if that's what they want to do or what they need. That's a resource that many communities offer. But where can people find your book? Because I know when people are listening to this, they're going to want to go right out and buy it. So where can they find it?
It's available wherever you would normally buy books. So we always recommend Bookshop to support the independent booksellers, but you can get it on Amazon. You can get it as an ebook, a paperback, whatever you think is best. You can also, we have a website, alltheloveafterloss.com. So we have blog posts there. We talk a little bit more about the book, so you can kind of, read up on our viewpoint and what's in the book.
Fabulous. So I will link to alltheloveafterloss.com and any other resources that you two want to send me after we finish recording, and I'll put those in the show notes. And I just want to thank you both, Kim and Huong, so much for being my guests today on Therapy Chat.
Yeah, thank you for having us.
Yeah, thanks for having us.
Thank you for listening to Therapy Chat with your host, Laura Reagan, LCSW-C. For more information, please visit therapychatpodcast.com.